Okay, off of the heart, we have a number of vessels that are going to be identified on the test, and you'll be responsible for. So here's the heart. We have the right atrium right here. So we have the superior vena cava that's dumping blood from the upper extremity and the head and neck back into the right atrium. Here down below we have the large vessel that is the inferior vena cava, where everything down below the diaphragm is returning that blood, shunting through the liver and the hepatic portal system to detoxify the blood, and then sending it back through the inferior vena cava also into the right atrium. Off of the center of the heart we have the aorta. This is the ascending aorta here. It goes back behind the heart. Right, and so back behind the heart you can see that it would be the thoracic aorta, and then here below the diaphragm we have it piercing, and anything going through the diaphragm would be moving through the diaphragm through what's called a hiatus. This is the aortal hiatus, here's the esophageal hiatus, and that's the vena caval hiatus through that muscle. So here is the abdominal aorta, and there are a couple of major branches off of this. Now, first of all, you should note that the abdominal aorta receives or sends out into these organs over 2/3 of the blood's flow out of the heart and left ventricle into these organs. So it's a large volume of blood here. The first branch that we see coming off that you're responsible for is this one. It is referred to as the celiac trunk. This celiac trunk has 3 major branches. It does the 3 regions across the top part of the abdominal cavity right here, which would be the right hypochondriac, the epigastric, and the left hypochondriac. If you notice right here we have the liver, this is the spleen, and the stomach would be situated right here with the intestines below it. And the branches that you see coming off of the celiac trunk would of course be to the liver, the hepatic branch, over here to the spleen, the splenic branch, and then the piece that's missing here would be the gastric branch that goes to the stomach itself. Right below this, you can see coming off the abdominal aorta, this vessel, this large vessel, this is the superior mesenteric artery. It's going to actually supply all of the intestines except for this lower left quadrant over here, the sigmoid colon, the bottom of the descending colon, and the rectum. The inferior mesenteric right here will do that, but every other portion of the intestines below these 3 regions will be supplied by the superior mesenteric artery and its branches. Now, off of either side, right here and here, you have what are referred to as gonadal branches that go to either the testes or the ovaries, out of just below where we see here the renal vein, and underneath that renal vein we have the renal arteries. Okay, so recap, we have coming off the abdominal aorta, we have the celiac trunk and its 3 branches, the hepatic, the gastric here in the middle to the stomach, to the greater curvature of the stomach, and the splenic over to the spleen in that left hypochondriac region. Down right below that, going to most of your mesentery or your intestines, you would have the superior mesenteric. This does not do the lower left portion, that's the inferior mesenteric that does the bottom of the descending colon, the sigmoid colon, and the rectum, portion of the rectum. Now, coming out of the sides, below the superior mesenteric and above the inferior mesenteric are 2 major types of vessels. The first would be the renal arteries, right? And the renal arteries go, of course, to the kidneys, and we'll also have branches to these 2 adrenal glands that we discussed when we learned endocrine system. That's the renal arteries, below the superior mesenteric and celiac trunk. Coming out of the anterior portion of the aorta, you're going to see the gonadal branches here and here, and then right below the gonadal branches you'll see coming out of the lower left side the inferior mesenteric that supplies the structures I've mentioned. Now, the abdominal aorta itself is going to terminate here and then divide into the 2 common iliac arteries that will then further divide into the external iliac here and the internal iliac that goes medial. Right down the center, coming out of the abdominal aorta, you have the median sacral artery that does, of course, the sacrum and the urogenital diaphragm there. So as we branch into the external iliac and internal iliac, here and here, the external iliac will pass beneath the inguinal ligament that goes from your ASIS, your hip bone, down to the pubic symphysis. And as it passes beneath this structure, it becomes the femoral artery that branches down into the leg, into the various branches below. Okay, so and we'll go over that at another time. These branches of the internal go medial to the urogenital system, and the external, again, as it passes below the inguinal ligament, becomes the femoral artery and its various branches down the arm. So that's the main aortal branches that we're looking at. We're looking at what comes off of the heart, but we've only done the abdominal aorta. Now let's go up above the heart. So off of the heart, we know that blood flow within the heart is going to occur as we return blood into the right atrium right here. It's going to move through the tricuspid valve right there, or the right AV valve, and into the right ventricle. And then from the right ventricle, it'll go through to the pulmonary semilunar valve and in through the pulmonary trunk and pulmonary arteries to the pulmonary circuit. It'll be oxygenated and returned from the heart through these 4 or 5 vessels, right? They are pulmonary veins, and they'll all return blood right here into the left atrium, which then sends blood through the bicuspid or mitral valve or left AV valve into the left ventricle, where blood flow will then occur at its greatest pressure from that left ventricle through the aortic semilunar valve underneath here, right? So there's the aortic semilunar valve. It'll take the blood that's oxygenated up into the aorta here, and at the same time that it is sending blood into the systemic circuit, it will release blood through this right and left coronary artery into coronary flow. The blood that enters into the systemic circuit is going to enter into the aorta. It'll ascend here, and on the right side of that aorta, you have what's called the brachiocephalic trunk or artery. This brachiocephalic trunk will provide any branches that do the upper extremity, head and neck, and it'll divide into 2 major vessels, the common carotid here that goes into the external and internal carotids, and it will divide here down the arm, and it'll become the subclavian artery. As it moves beneath the pectoralis minor muscle, it becomes, underneath that muscle, it is actually, that small portion of it is the axillary artery, and then inferior to that muscle's border, lateral border, it'll become the brachial artery, which then would divide in this. And if you look, this arm right here has been pronated, so that the back of the hand is showing right here, and the back of the hand then we can see a crisscrossing of the radius and ulna. So here's the radius bone, and this is the ulna with the pinky, and therefore this would have to be, this one is the radial, and that's the ulnar artery. This side, it's a little bit easier to tell. Coming off of the left side, as you supply blood to the left side, it's slightly different because there is no brachiocephalic trunk or artery on the left. These 2 branches, the common carotid up into the head and neck, and the subclavian, the left subclavian, come directly off of the aorta itself. They do not have a common trunk like we saw on the right. That pair of arteries, the common carotid and the subclavian, will supply the head and neck and then move down the arm, just the same as we saw on the other side. So this would be the subclavian underneath the pec minor with its superior attachment at the coracoid process of the scapula. Underneath it is the axillary portion, and then down below it becomes the brachial artery down the arm, and then it'll divide in the cubital fossa right here, as you can see, into this ulnar artery and radial artery respectively. The radial artery right here at the base of the thumb is a common area to palpate if you're looking for a pulse, to take a pulse when exercise is occurring, or up in the carotid artery as well. We'll go into that later. One last thing, each of these arteries, the largest of these vessels is an elastic artery, the aorta, as is the iliacs down here. Then we have also those branching into muscular arteries like the carotid, the femoral down below, and it's the muscular arteries off the elastic, largest arteries, that are targeted by vasomotor constriction and dilation according to heart's pressure.